we talk about psychotic depression, is that the same thing as depressive psychosis?
So basically, the actual condition is called depressive disorder with psychotic features.
Okay.
And you can't diagnose it unless you designate the depression as severe. And that's because most people, if their depression is not severe, they're not going to show psychotic features related to the mood episode. And when somebody has a major depressive disorder that's severe, that's when you have to designate severe without psychotic features versus severe with psychotic features. And this is very different from somebody who, for example, has something on the schizophrenic spectrum where with or without a mood disorder, they're having symptoms of hallucinations and delusions or thought disorganization. It's also really different from somebody who has a mania where they have accompanying hallucinations or delusions. This is somebody who has a primarily depressive episode, and at the most severe point of that episode, they have significant paranoia, for example, or some kind of distortion of reality where they don't seem like they're really understanding what's actually going on around them. And so this is a very specific type of psychotic feature expression that's tied to a depressive episode.
But what are psychotic features?
So psychotic features could span anything like paranoia and mistrust about individuals around you and what their intentions are for you. It can be things that are delusions of persecution, where you think that people are out to harm you. It could be like delusions of grandeur to some degree, that maybe you're more important than you are, and thinking that there's all these kinds of ideas where maybe people are obsessed about you and that maybe they're trying to follow you around. It can be delusions of jealousy, where you think that there are people who are either jealous of you or perhaps you are even jealous of another individual and you become very obsessive about them. But it could also include hallucinations. It could include auditory hallucinations where you hear things that aren't there, or visual hallucinations where you see things that aren't there. And so for these individuals, oftentimes they will require an antipsychotic medication to try to stabilize them while they're in the middle of this depressive episode.
Right, so in this scenario, you may be treating the psychotic features separately than the symptoms of depression.
Right, exactly. And also these individuals, once the depression is managed, the psychotic features do go away. So again, the psychotic features do not exist outside of the depressive episode.
Right. But because the psychotic features are likely so causing such impairment on the life, they are treated immediately somehow.
Yeah, well, as long as the individual is presenting with that.
Right.
Oftentimes an individual might have had multiple major depressive episodes without psychotic features and then all of a sudden have one with psychotic features. And so it can be very dysregulating for the individual and the people who are helping them manage this condition. And so it may take a while before they realize what's going on and go to their treatment provider for additional resources.
How prevalent is this?
It's not super prevalent. We don't have very specific prevalence rates, but it is certainly one of the less common specifiers. And again, it can only be applied when somebody's major depressive disorder is designated as severe. And so a lot of times people will have depression, but it's more mild or moderate. This is somebody who already has a very severe depression, and in the middle of that, they end up having something that looks a little bit like a psychotic break.
Can this get misdiagnosed as schizophrenia?
Yes. And it does oftentimes, especially when an individual's major depressive disorder is not so much on the sadness side, but more so on the loss of interest side. Because you can get a major depressive disorder diagnosis without a very deep sadness, and the main symptom is actually something like anhedonia or a loss of interest. And so then when you look at an individual like that, they kind of look like somebody with schizophrenia, because schizophrenia also comes with what we call negative features, which are things like loss of interest, loss of motivation. And so it can very much get conflated. And when individuals go to an emergency room, oftentimes they only have a few days to observe you. And I find it so shocking that so many emergency room diagnoses include something like schizophrenia, because I feel like it's too soon to be able to make that call. They don't really know this individual long enough to make such a severe diagnosis, and then that diagnosis ends up following them to the next levels of care.
And schizophrenia is rare as well.
Yes.
You know, so it's like you're choosing one rare possibility over another rare possibility, but
Yeah.
you know, a wrong diagnosis. This is why the education is so important.
Right.
Because the wrong diagnosis means you might get put on the wrong meds and treat something that you don't even have.
Absolutely. Or there's also substance-induced psychosis, which of course, when individuals suffer from major depressive disorder, sometimes there's a higher risk for alcohol and substance abuse.
Right.
And the alcohol and substance abuse might be what's producing the psychotic
Right.
symptoms and not the major depressive disorder.
Wow.
So you have to be able to eliminate that from consideration before you diagnose somebody with major depressive disorder with psychotic features.
Thank you for your invaluable knowledge and insight into this, Dr. Judy. We've talked a lot about different therapies. MedCircle has series on all of those types of therapies, so if one stuck out to you, make sure you check out that series. We also have other series on depression, anxiety, substance abuse. They are great supplemental series to go to this one to maybe fill in the gaps on some of the areas that you wanted more information on. And I also recommend you watch our series on the different types of medications and the different types of providers, because this is, like Dr. Judy mentioned, this is a collaborative effort between you and your mental health team. So the more educated you are, the better you can be as a member of your team. Thank you guys so much for watching this. I'm Kyle Kittleson. Remember, whatever you're going through, you got this.